So I've been talking about the theory and the science approach associated with improving patient safety and developing a nurturing safety culture. So the kind of stuff I've covered is the world that we're currently in, which is relentlessly negative, and trying to think, is there a different way that we could look at that? Which is looking at a new way of studying harm by looking at how we succeed rather than how we fail. But underpinning all of that, the importance that I think that we needed to bring out was how people work together, the relationships that they have, and how hard it is to develop a culture in which everyone is kind and supportive of each other.
And I've shared with people experience of leading an organisation and a service, specifically a maternity service, through significant cultural change that came from a very negative place, one of fear and punitive approach, to really listening and engaging with the people that know what really needs to happen in order for them to be able to work safely and feel safe in work and deliver safe care. And that's the frontline staff and the women and families that are using those services in those communities. And I think the take-home message for me today is that actually we all talk about it, but actually as system leaders we need to be doing more to support our frontline staff and our communities.
I think from when I've spoken with everyone else in the follow-up sessions, which have been so brilliant, is that the things that they took away were the importance of kindness and how it really doesn't cost or take too much effort just to be kind to somebody. The importance of saying thank you, and really saying thank you, meaning it. But the third thing, which is crucial to both of our talks really, is to truly understand the everyday work that people are in, the situations and the circumstances they're in. Because only by truly understanding that can you actually help them cope with their everyday.
I don't know who said it to me, but it stuck with me forever, is that kindness has never caused harm. And that's really, really powerful. And if we can be kind to every single person that works in our services or comes into our services, just by doing that we'll reduce harm and improve safety for people, won't we?
Yeah.
And you're absolutely right, Suzette. Listening to people, really understanding what makes it difficult and almost impossible sometimes for them to do the right thing is really beholden on us to understand that and make the changes that we need to. And I really like the idea of systems and processes being set up to enable people to do the right thing rather than them only being there to remonstrate when they've done the wrong thing.
It's not just a nice to do, it's a must do. What you've got to do is be really human and right from the very beginning talk to them as if you would talk to your loved ones, and find out what do they need and what can you do to help. Might be just lots of information or a person to communicate with on a regular basis, or they might want to be left alone for a while. You just don't know. You've got to find out what they need, talk to them about it. And then once you've done that, the step following from that is at a point where you actually want to hear from them in terms of what actually happened. It may be too early, very early, if that makes any sense. So you want to figure out the right time to actually then involve them in getting as much detail as possible about what happened, their side of the story. And without both supporting them and getting the truth from them, we've only got half the message.
Fundamentally, when we're providing services, we absolutely need to hear from service users and patients what it is that they really need and want from services, rather than us thinking because we're the health professionals we know what they want, because very often the two are very far removed from each other. And I think if we truly build services built on what patients and service users want, then we will have by default a proactive approach to safety rather than a reactive one. So if we can build on the positives and that we're meeting their needs and their wishes and we're truly listening to them all of the time and they're truly involved in all of their care, and driving that care, and we're listening, actively listening, then I think that we can really proactively reduce harm. And when we do make those mistakes and don't always get it right, it's absolutely everything that Suzette said. So them being fundamentally involved and part of any investigation that might happen, and then making sure that we follow through on the things that we've said that we're going to follow through on. So be consistent and say what we're going to do with, stick to what we're going to do with.